Is it roll?
Yep.
Can you take off your front hand? I just want to, yes, good, thank you. You can put it back. I was not sure.
It's all right, it's going.
I didn't see that. Okay, guys, we're starting with the front of the leg, yeah? Front of the lower limb, should we say. First of all, let's say you're starting the treatment now. Anything I should change in the way that the client arranged, or towels, or anything that... More towels, okay? Anything else before? Pillow. Right? Just put the pillow here. Thank you. Anything else? Anything?
No, it's pillow based.
So the pillow should be underneath the knees. Why? It relaxes the joint and it relaxes also the lower back. When you start, please put it wrongly and you would feel the difference, okay? So now, right? You can put that on top as such. So remember the tea towel. Anything else? Yes. Anyone can have. Anyone has another towel? Yeah. Yeah. Thank you. Throw it. So at times you need some sort of another towel or a pillow underneath the head. You can check it with them. Is it comfortable this way? Good. Help. Anything else?
I always check the alignment from head to feet
Before.
if they are fairly straight, not.
You can.
often.
Anything more obvious?
Get the headrest off.
Thank you. Take the headrest. How many of you forget? It's more difficult for you. Take the headrest, and where do you put it? Underneath the table. Good. Fold it underneath the table. Good. Are we kind of ready to start? Yeah, okay. So, lower limb, yeah? Who would be benefiting from treatment on the lower limb?
Those are on their feet all day.
So people who stand a lot, like
Shop work.
nurses, people who work in a shop, sorry?
Hospitality.
Hospitality,
Massage therapist.
teachers, sorry?
Massage therapist.
Massage therapist. So those who stand a lot. Any other group? Sports, athletes, yeah? Anyone else?
Who sits down always, so maybe...
Yes. Those who do the extreme opposite, they sit, they don't have good circulation. And they may have some, they feel that their lower body is kind of not fully related to their body. They're not linked to their body, so it's nice to give them as well. Okay, now we need to start with the draping. Okay, so come closer. So what you need to do, you fold this table, you fold the upper table. Before that, you can take the leg a little bit to the side, so you can more freer. Then you're holding the towel in two places, the top and the bottom part of the side. And what you do is just rotate it. And then you leave it. So the other leg should be always fully covered. I don't do that, yeah? So the other leg fully covered, and then what you do, you just tuck it underneath the leg, opposite leg, yeah? So it's ready nicely to start with. Let's talk a little bit about muscles of that area. Which muscles are there in the lower limb that you remember?
The quadriceps.
So quadriceps. Quadriceps start really from the front of the hip. Now, does it go to here or to here? So does it go over the knee joint?
No.
It does.
Yeah.
It does. Because what it does, it straightens the knee joint. How do we call this movement?
Flex.
Extension. It's straightening it. Extension, and this is flexion. Yeah? Okay, so quadriceps, right? The front of it. And there are 4 muscles here. This is just representing where this muscle is. Any other muscles around that you know?
Tibialis Anterior.
Let's continue into the here before. So we have a few more of the adductor. Adductor are the muscles that adduct the hip joint. How would you, can you all show me what adduction of the, so from here it goes together. So it brings the legs together. So where would you put the adductors? Here, here, or here? Medial. Okay, so this is where all the adductor muscles are. And they all call adductors brevis or magnus, beside one that called gracilis. And that is also the same position. So we covered the medial, the front. Now what is on the lateral side? Have you come across the iliotibial band? Yeah. So it is a piece of connective tissue wrapped like that. So again, it goes below the knee, and listen to the name, ilium, tibia, band. So it crosses from the tibia to the ilium. And it's not a muscle, it's a piece of connective tissue. Yeah, and some other time we may discuss what it does. Anything on the back of the thigh?
Hamstring.
Hamstring. Fantastic. Good. So muscles here. If you all, can you all feel your shin bone? Yeah? Okay, so this is the medial. What happened to the lateral of your leg? Which muscle is in the lateral of your leg?
Tibialis Anterior.
Tibialis anterior. I think Jess, you said that, or? Oh, you, Sean, okay. So tibialis anterior. And that's a really funny muscle. What it does is something like that. It crosses. And what it does this movement. How do we call this movement?
Dorsiflexion.
Dorsiflexion. Very nice, good. So can you do all that? Put your hand here and do that movement and feel. You need to go a little bit above, yes? Can you feel when it tightened?
Yes.
Yeah.
Yeah, good. So tibialis anterior, dorsiflexion and inversion as opposed to eversion. Inversion. Okay? What do we call these two muscles here? Gastrocnemius and soleus. Okay? Okay, I think we can start, right? So we could start, if we decide to work on this muscle, we could start with a nice hold into here. And can you tell me what, while I do the draping, what hold may help? How does the hold may help into the massage?
Relax.
It relaxes, yeah.
Introduction.
Give them safety, relaxation, yeah. Right. Now, what happened usually is that when I started Effleurage, I see that your Effleurage are good, but when it comes to petrissage, we need to work more on the body position, okay? So really start with Effleurage. Really move your body. So think about moving it side to side, big stance. You know, don't do it. If you have a narrow stance, then you must do it with your leg, with your body. Yeah? So really try to think that you belong to the royal family. You never go down, you never look down on anything, yeah? Look horizontal, you know, don't look to the body itself. Okay, so starting Effleurage, both hands. What's the effect of Effleurage? Warm the muscles, relax them, increase blood circulation. Good. So you could be doing few variations. Good. Do you work deep onto that area, onto the patella? No, so you skip it, but you don't have to really lift. You can really be sensitive and just know how much to give. Okay. Next is Okay, how much effleurage do I need to do?
5 minutes.
Is it really in the time, or is it when you feel that it's
When
ready?
you feel it starts, the skin starts to get nice and warm.
So the skin start to be nice and warm. So if the person is coming after sauna, might be, 15 seconds, or sometimes you need to spend a lot of time doing it. Okay. When you do effleurage, you need to really start feeling the texture. So now I get into deeper effleurage, okay? So I really start feeling, is it tender here? No? Yeah, a little bit, okay? And I start moving into petrissage, okay? So I now getting into parts. I can start with the thigh, yeah? Maybe the camera can go a little bit this way. And you start with this technique, which we call ringing, yeah? So you really try to distort the muscle. You need to do it deep enough to make a change, but not too deep to cause pain. If you want to do even further, then you can wrap it up all the way to the hamstring, yeah? But for now, I just keep it this way, ringing, right? Figure of 8, very similar. Is it too deep? No? Okay. So I start really, what we're describing in books is different. I want you to really feel the differences between these muscles. So now I'm on quadriceps, yeah? Right, so I really can squeeze them as a group. Now it's kind of on the gracilis and adductor muscles. Okay? So we have ringing, we have figure of 8. I think this is what Sally called chocolate breaking, is it? Okay. So use a lot of your body. Here I need more body weight. When you go into the upper thigh, you may want to just continue with one hand. Just the lateral side. Good. Any other technique we've learned? It's more of a revision, yeah? We did the knuckles. And all the time look at their face to see. Good. You can do some of more compression in an area that needed. How's the pressure? Can I go deeper? If the client asks you to go deeper, what do you need after that to confirm? When you go deeper? Sorry?
The pressure is okay.
Yeah. So you ask, the pressure is okay, can I go deeper? And they said, yes, you can go deeper. What you need then to ask them after going deeper? Is it deep enough? So is it deep enough? Is it deep enough? Or?
It's comfortable, it's nice.
Okay. So I can move into reinforced thumb. Good. You can do the compression also with your knuckles on the iliotibial band. For that, what you can do is just one hand to rotate. You see what I'm doing around the ankle? Hold it there, and then you can do it quite static, or you can do circles. So everything start and end with my stance, with my body. Hands are really relaxed. I feel relaxed, my shoulder relaxed. Okay. What comes after? We did compression. we need deportment. Right. I'll try to do both ways and see what is more comfortable for the client, okay? First is without towel. So this is hacking, right? Do you remember a few more? Cupping. Beating. And then we're pounding. And we'll do now with towel. Or we'll do it on the other side. Which one do you prefer?
I prefer without.
Without.
Yeah.
Okay? So, you see, I thought that you prefer with, but
It's a bit, for me, just personally, it's a bit harder, which I like.
you like it.
Yeah.
Fine, good. Right, so do that with or without towel and see what they prefer. Coming to the leg, there is actually from the front not much you can do because you have the shin bone here and you have tibialis anterior. You can start with a bit of effleurage and then it's kind of a thin and long muscles. So you can't do any kind of ringing and figure of eight. You have a narrow strip of muscles running this way. So you can work with your base of your wrist. You can work with your knuckles. Reinforced knuckles. Yeah. You can work with this part of knuckles. It can be quite sensitive. You know, who've had tension in this muscle ever? Yeah, from where? What was? Sorry?
I when I sprained my ankle.
You've had here.
That on the recovery that got really tight.
Okay. I'm not sure how is the link. Yeah.
I've had
Anyone
it in the
else?
gym.
What was the link? Yeah.
Just a foot condition. It's just a.
Okay, foot condition when you kind of remember the trapped nerve when you are careful, it will hold all the muscles around. Yeah. Other people?
Yeah, it's when I was walking very fast, I was
Mhm.
pain and
So if you start doing exercise, or if you're not using flip flops a lot, and suddenly you use flip flop, then it will be quite tight as well.
Is the football player damaged all the time?
Sorry?
The football player, did he damage that?
I'm sure, yes, with all the kicks. Okay? Okay. So pretty much very simple. You can do a reinforced thumbs, etc. I'm sure that you know that. You can do, then what you can do the deportment also in here, but more on the muscle itself, which can give quite a nice relief actually for a lot of tension. Different rhythm. And then few nice effleurages as well. Good. Before we continue, and that was quite simpler, isn't it? A lot of it we did before. So I want to throw one more thing for you to try. And that is to work both on the front and the back of the legs, of the lower limb together. And how do you do that? You're taking the towel and securing it around, and then what you do is you just lift the leg this way. You might want before to just, can you lift your legs? Thank you. Good. That's it. Good. So you might want to take the pillow away from that side and then wrap the towel around completely, yeah, like that. So you kind of create, you create a cradle with two of the towels around their hip. Then what you're going to do is you coming and tell them, I'm going to sit on your feet. Because sometimes if you don't, they think it's a mistake and they will try to take their feet away. Yeah? You're keeping that this way. And then you have an access to the, which two muscles I have here? Gastrocnemius and soleus. And which muscle I have in here? Okay. Now, I don't feel it's very comfortable for me. And the reason is that I have to reach quite a lot forward. So what I would need to do is actually bend their knee a little bit further. So I will come closer. Now, I feel that it's a lot more comfortable. So when I work on those two muscles, I can nicely, actually kind of leaning back and not too strong, try to kind of separate the two heads of the gastrocnemius muscle. Yeah. Now, I can do it in two ways. I can do it ineffectively when I'm feeling quite, stressed, and do it with my shoulders and all my energy. Or just talk to myself and say, calm down. How would it be comfortable for me to do? And then lean back. So I don't want no one to sweat over it, yeah? Very easy. It's part of the massage to really think about you. Good. Then hamstring. What you can do is use your knuckles to go over, and I need to change it because now I need the force. Before that, on the gastroc, I need my weight to be that way. Now I need my weight to be forward. So I would use my knuckles. Okay. To tell you that is the most comfortable position working on the limb is not. But if you don't have time and you want to cover both front and back at the same time, that would be a choice, okay? So practice it. There would be there is a case of trust here. The client should trust you. Otherwise, they will hold the knee quite strongly. They will hold all the limbs quite strongly. So once in a while, what I do, I just move it lightly to see how much they relax, because they can be in this position quite tight. Means they hold their muscles. Can you do that? Now, if I try to move, you see what happens? She doesn't move. Okay, relax. So I need to assess, and I need to assess her. So give it a nice move once in a while to kind of see that they are not tightening their leg. If they're tightening their leg, it's a no-win. I can do the best massage, still not good. So I need to really assess once in a while if it's all right. Good. Cover. A lot of what I've showed, I think it's a revision for you. Yeah, it's a new area, but the same implication of the same technique. Okay. So she would give it a go.
How would you mobilise the ankle in this position?
Now